Hello everyone, hopefully everyone's having a great day so far. Just wanted to let you know that we're getting started and we're going to be talking about the Code of Ethics today. Code of Ethics. Due to recent events, Three Mountains Regional Hospital will need to re-establish the trust in the facility, employees, and staff. To do this, we will be making an intake packet for new patients, and included in it will be the Code of Ethics. The Code of Ethics establishes what is right and wrong for our organization. Once they see this message, the patients will get a better understanding of our goals. Today, we will go in detail over our Code of Ethics. A Code of Ethics is important for businesses to establish to ensure that everyone in the company is clear on the mission, values, and guiding principles of the company. Patient relations. Patient and physician relationship is based on trust. Physicians own ethical responsibility to place the patient's interest over their own. Physicians use sound medical judgment on patients' behalf. Physicians advocate for their patients' welfare. In other words, to get patients' trust, physicians will give patients the best care and will not neglect the patient's needs. Physician activities. Physicians will follow all laws. Physicians will respect the honor of their profession. Physicians will accept their self-imposed disciplines. Physicians that witness illegal or unethical conduct should expose their fellow physician because it is disrespect to the patients and the practice. For example, if a physician knew that another physician was prescribing narcotics to patients that didn't need them, that physician should go to the medical director and let them know. If they want to remain anonymous, there is a hotline to call to report unethical or illegal activities in the physician handbook. Prescribing narcotics in unnecessary situations is illegal and unethical. It does not show respect to the profession. Billing for services. Patients will only be billed for services rendered. Billing for services that have not been performed is illegal and unethical. Medical billing and coding team will review charges daily to make sure there are no discrepancies. Sometimes mistakes can happen and the medical billing and coding team can see that, but if it's consistent, then there will have to be further investigation. Political activities. We do not take any prohibited political activity lightly. Prohibited activity can be defined as any type of support with any campaign for elective office or any political organization. For example, a physician will not be allowed to take a local official's bribe if they would promote them in the medical practice. Maybe they promised more patients or a new facility being built in order to gain more popularity. It still will not happen. Conflict of interest. Individuals shall avoid engaging in conflict of interest whereby personal, financial, or other considerations have the potential to influence or compromise professional judgment and objectivity. For example, if there was a patient that was in a coma and someone said they would pay them to just pull the plug, it wouldn't be the right thing to do to accept the money. It would only be the right thing to do to let the patient go if that person was the power of attorney, but we would still not accept the money. Privacy. Healthcare staff is to obtain and process data that is necessary and directly related to their duties. We want to keep patient information safe. We will not share any patient information without consent of our patients. Patient safety is among the top priorities. We will be following HIPAA rules strictly. Patient records will be monitored 24/7. Whether it is a famous person or not, medical records are not to be accessed by medical personnel unless they have been authorized to. The health information team will find any breaches and they will be reported to the managers. Communication through social media. No defamation of employees or patients is allowed through any type of social media. Our organization is committed to treating others with respect and dignity. Any acts of defamation can lead to termination. Social media is not a place to talk about our patients or facilities. It is open to the world. Any acts can harm the reputation of a patient and our organization. Professional behavior. Our staff is well aware of the image we uphold. Professionalism is vital when interacting with patients or other healthcare personnel. We are here for the patients, and our facilities are not a place for disruptive behavior. To allow the best care for our patients, there is no time to be unprofessional. Any type of disruption in professionalism can result in disciplinary action. Efficiency. We strive to work fast, yet give the best possible service to give the best possible experience. The patient's time is worth more than our time. For example, if a nurse was ending their shift, it is important to give the next nurse a rundown on their patients instead of leaving immediately. There are multiple patients that need help, so it's best to work efficiently. Integrity. Integrity sums it up for us at Three Mountains Regional Hospital. We will all share the trait of being honest and having strong morality. Our patients will be our number one priority, and we will treat them with the dignity they deserve. Following these code of ethics will help us give better service and gain trust to those who need us. Once everyone is clear on the mission, values, and guiding principles of the company, we will grow to be a better organization with a brighter future.